You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Ever since COVID, what we know to be the norm is rapidly changing. In order to adapt to this, your business must adjust and transform accordingly. For pharmacies, unlocking the profession's potential to improve patient care is where this opportunity lies. Today's product-focused role of the pharmacist calls for the industry to move toward clinical services. The focus will be on prevention over treatment, and care will happen in the home or community. As accessible and trusted healthcare personnel, pharmacists can play a big role. Happier at Home harnesses this opportunity by showing the benefits of expanding your pharmacy into home care services and how this is a recipe for success. Innovation and growth will help community pharmacies to continue to exist and thrive in the future.
Hey, we're back. Happier at Home PRN. I'm here with two pharmacy owners. I tell you, when we talk about services that are number one needed, and when you think of the word needed, I'm thinking of keeping people on track for health so that they don't go back to the emergency room or they don't fall off on a diabetes plan or something that they should be taking. When I think of nursing homes, assisted living centers being packed to the hilt, there's no room for growth. People don't want to go to these centers. They want to stay in their homes. However, sometimes they don't have a son, a daughter, a family member, a friend that can check on them. So we have home services, which is great. We have our community pharmacies, which is freaking awesome, and what they do for the community. But the merging of those two things together through Happier at Home and what Debbie has set up is so important to give pharmacy owners a track, kind of perfect that track as much as you can, and then flavorize it with your own specialty, your own home care pharmacy design and what that means. I have two guests, two pharmacy owners, Dana Porter. I'm just excited that you're here. Welcome to Happier at Home PRN.
Thanks, Todd. Thanks for having us.
And a shout out to Toby Porter. Welcome, and can't wait to dig into this with you. Welcome to the show, Tim.
Thanks a lot.
All right, two non-pharmacists like me. I'm not a pharmacist. I don't think there's anything wrong with that and running a pharmacy as long as you have good people on your team. I want to start with Dana. Just tell us, how did you get into the business of community pharmacy? What attracted you to that business? And then you got to tell us how you partnered up with Toby too.
Sure. So Toby is my husband. We have, I wouldn't say inherited, but it's a family business, the pharmacy business. So we both kind of fell into helping out with the family business many years, probably 20, 30 years ago, and have worked in all aspects of the business. I do more on the business side. Toby works the counter. He's a technician as well and has done literally every job in the pharmacy, delivery driver, DME technician, pharmacy technician, and I do more on the business side. So back in 2016, we purchased 5 of the family businesses ourselves, and have, bought and sold since then businesses. A couple years ago, I'd say about 2.5 years ago, we got an email from Happier at Home talking about their services. And we thought, oh, this looks interesting, kind of knowing what was coming up with the DIR hangover and trying to be a little bit more prepared for something outside of, insurance payments. So we started to do the research and talk to Debbie, did a lot of due diligence on the franchise side, as well as exploring other home care businesses, franchise models, and ended up settling on going into business, purchasing a franchise from Happier at Home in the end of 2022.
That is cool. I love husband-wife success stories. My wife's a nurse. She works at a maximum security prison. I've had a dream that she'd come aboard and become our COO and run things because she's much better at operations, but she's like, absolutely not. And so Toby, you're lucky to have your wife and partner helping you to grow an empire.
Yes, well, it's been a long time working together. We actually shared an office. We shared four walls for a number of years. People did ask us for a long time, how are you able to do that? She's easy to get along with. What are you gonna, and she's really good at her job, so why would I have a problem? Yeah, but it works for us. It works really well.
What made you want to get into the pharmacy business? Because I tell you what, it's complicated. I don't have to tell you. You're in it.
Well, it's pretty simple. I started my I want to say professional career in the fire department. And in doing that, at that time, I was still, like Dana said, I was a delivery kid. I was a clerk, and I went and got my tech license to kind of help continue paying for school and books and college. So when that at that time, we also had opened a coffee house, or Dana opened a coffee house in one of our pharmacy locations. So to add another hat, I decided to get certified as a barista and manage the coffee house. And so I worked in that facet for a while, and fire just kind of fell to the wayside. I enjoyed working with people. Sales is, I guess, part of that gig, but interacting with folks constantly, new people every day, and regulars that come in, and I realized this is for me. Independent pharmacy is a career that I could see myself moving down. So here we are.
It's awesome.
Yeah.
Enter in Ken Tai and his empire that he's built out in California, the 986 pharmacy families. I'm so proud of what he's built. He's been on our podcast over the years, giving us advice, giving us updates on how he's grown. So you connected with Ken and his team. Tell us about that. I want to understand how you evolved and how you found Ken.
So we've known Ken for a long time, and was involved with the USC School of Pharmacy. And actually, when he was a pharmacy student, my cousin was in his class, one of our other business partners. So we have a long personal relationship with Ken and have, kept that up over the years. So in the city of Whittier, we had a pharmacy and he had a pharmacy. And so we kind of started having discussions last year about coming up with a partnership in the Whittier area. And came to an agreement. So we combined those two pharmacies and their medical equipment side, and are working now as the 986 pharmacy in Whittier. So we own that one location in Whittier with the 986, with some partners in 986.
That's cool. I like it. And what I understand just from being in this industry for more than 20 years now is, just like you said, you've experienced less and less revenue per month, per year, based on what's happening with the PBMs. And we're in the middle of PBM reform. It's important, obviously, for the sustainability of public health across the nation, but we can't wait. You have bills to pay, you have employees to care for, and patients in your community need you. Over 7,000 pharmacies have closed just in the last 24 months. The pharmacy desert impact on our nation's health has not even hit its peak. So it's getting worse before it gets better. So business-minded pharmacy owners who are thinking of other services that the community, number one, they need, number two, they can afford, and number three, ties into the ecosystem of better health overall, which is always nine times to one meeting with your physician. People are seeing their pharmacist 9 times a year in comparison to their physician, in a ratio and strategy. So Happier at Home comes to mind, bolting it on to an established community pharmacy that's already trusted. And now you're able to pull services that are very much needed in your community. Talk to us a little bit about your Happier at Home franchise. Talk to us about kind of some of maybe the complexities and getting it going, and what your plans are for the future.
So the Happier Home franchise, for us, the biggest reason we decided to move forward, it takes us off of the dependency on insurance payments. It's all private pay. We don't accept any insurance. We do work with long-term care insurance, but in those instances, we bill the patient and then they collect the money. So it's really refreshing to work in business where you get paid for what you provide. And we're not carrying anything, right? The day that I bill, it's all auto paid, either on a credit card or a bank card, and we get the money in our bank. So for us, it was getting off of the insurance, reimbursement structure and getting into, a private pay situation. It also allowed us to run it out of the pharmacy. So from an overhead perspective, we're just using our offices and using our cell phones, and there's no overhead. So the biggest cost we have is just paying the caregivers to go out into patients' homes. Also, because we're in the pharmacy and we're really well connected in our medical community, the referrals are coming pretty easy to us. I was at the pharmacy a couple days ago, and Toby went out and talked to a patient who saw the sign, wanted to talk about services. We have a table in there, and we get a lot of referrals from medical groups in our local community.
I was actually an RN that was looking to become a caregiver. So yes, the referrals, it's twofold. There are wonderful people in our community that want to give back also. The medical, the CNAs, the registered nurses, they're looking for, a way to work weekends. And this is they're natural givers, they're in the service industry just like we are. So to add on to what Dana said, it's extremely refreshing to be in an industry where your hard work and the product that you develop, you get reimbursed for every penny. All of that blood, sweat, and tears, and you get reimbursed the way that you should be reimbursed. It's something that those of us in the pharmacy world it's odd. It's odd to actually provide a service and get reimbursed for what you asked for.
That's upsetting to have to say, but it's the reality. Pharmacy owners have done things for years and years and years that they haven't been paid for, and they expected to make a living off of a dispensing fee that has dwindled and dwindled over the years, and now, of course, we're in the midst of battling for the existence of independent community pharmacy. So the padding and the extra opportunity that this presents you to stabilize, do much more for the community than just bring entrepreneurial success to business owners. It's jobs, and more importantly, it's healthcare, needed healthcare services, home care for that the citizens need. They want someone that's tied into a bigger picture. I kind of want to talk to you about that as a pharmacy owner. What other things have you seen that you can pull into the business from the pharmacy sector? I'm thinking of durable medical equipment. I'm thinking of medication sync programs. I'm thinking of diabetes counseling or nutritional counseling. What other things do you think you could see being bridges from the home care to the pharmacy?
We do. I do all of the assessments. So by that, I mean, I go out and I visit every single potential client. I go to their home, I meet them, and I meet whoever the individual is that's requiring care. And I assess the home. When I do that, a lot of them are well equipped to take care of their loved one. Some aren't. Some do need transfer benches, shower chairs, maybe some grab bars, just to make life a little bit easier. These are all services that we provide within the 986 pharmacy selling durable medical equipment. Sometimes it's just a mere suggestion and they say, oh, that's great. Can you bring it next time you come? Sure, love to. Sometimes it's, like you said, MedSync. We don't offer the service to administer medication with Happier at Home, but what we do is medication reminders. So having those MedSync cards and bubble packs makes everyone's life a little bit easier. And then it comes into a key word that we use in the pharmacy world of adherence. Adherence keeps folks healthy rather than backslides and ending up in the hospital. Hospitals and urgent cares is not where these folks want to be. They want to stay at home.
Yep. Absolutely.
Yeah.
Absolutely. There's a psychology to this. There's mental health to this. We know that people that have been taken out of their homes and put into centers, sometimes the depression alone is the end of them as an individual, because they don't feel happy. They don't feel kind of in their realm. They don't get to have a cat or a dog, because
Right.
they lost their way. So I love this. I absolutely love it.
Yeah, I think, the other thing in the community is, you're already a provider, right? And a trusted provider.
Yep.
And we've heard so many horror stories, probably that you have too, of these companies that are, not providing legal services, aren't providing, properly trained caregivers. So for us to be that face to provide that care, is really great. And we have really been able to help a lot of people, and I think it's nice to be paid for those services fairly, but it also is nice to be able to do your job, right? Our hands are tied a lot of time in the pharmacy and what we can and cannot do based on the reimbursement. And here we're really able to help people, the ones that want help. And we've had some that whose kids want help and the mom doesn't want help. And, we've had to pivot on those, but it's nice to be able to really help people. We have found we really like to match. Toby does all of the assessments. I do all of the hiring. We actually don't have any manager that works for us. We kind of figured we'd try this on our own for a while to see how we could just kind of manage as, owners of another business. So between the two of us, we do this on the side. And when I hire everyone and he goes out and assess, we really work hard to match. And that matching has provided us a lot of success. Clients are very happy because we're intentionally placing caregivers that match with their needs and their personalities. So, we've had great success and a ton of people.
It's a discussion that we have constantly. It's not just a 9-to-5 job, but Dana and I we've worked together for so long and we do work well together. It is a matching. It's, hey, we have this client that has this need. We really need a more skilled caregiver for this. Who do we have that's available? And that's where Dana comes in. Meeting caregivers, you can tell immediately who they're going to click with, and you can tell immediately who they're not going to click with. So it is a matchmaking game. It's Dana and I are it's the love connection of caregiving. Not every first date is a winner, but we do have a caregiver that will work with everybody. Somewhere, somehow we can make that match. But that is the fun or the rewarding part when you get a caregiver out placed in a home and I get that text from a client. Oh my gosh, she's amazing. I love it. Thank you so much. You're welcome. It's great.
That's awesome. All right, let's talk about the firewall between the pharmacy business and the entity that's set up as the franchise, Happier at Home franchise from, in your case, this is Whittier, California, Laverne, California. So I'm a pharmacy owner. Is there anything that sticks out that Debbie's giving you guidance, the legal team is kind of giving you guidance as to what you're not able to do in home care in order to separate those two businesses?
So in California, you have to be licensed. So this is our Happier Home is a completely separate entity from the pharmacy. It has nothing to do with 986, except for the fact that we're in the same city, and we're working together with that base pharmacy model. But Happier Home is its own entity. In California, there are lots of, surprisingly regulations and license requirements. So the Happier Home team helped us get through those requirements. And that lays out in California what you can and cannot do under our license. So we are a non-medical caregiving agency, which allows us to provide care in the home for meal preparation, like housekeeping, companionship. We can do incontinence care, bathing, dressing as well. We cannot touch medication. So we do medication reminders, but we can't, that's our biggest thing. We can't touch medication. So if that's an issue for a client, we can't take them on. They have to be able to administer their own medication. But I know across the United States, there are states that require no licensure. There are some states, I believe New York, that doesn't allow you to do personal care, any of the incontinence or bathing or dressing. So in California, every state specific, and the Happier Home team was awesome. They provided us all the services that were necessary to get through the licensure process, to get approved, and make sure we're up to date with policies and procedures and hiring documents and all of that. It was great, really turnkey.
What I like about this is it's coming at the right time. We are having an explosive demographic change to our population where, 65, 75, 85, 95, people in their hundreds, people are living longer, and we're seeing the baby boomers increase the next year. 20 years, over the next 20 years, the expansion of a specific demographic that is going to need additional assistance that would be candidate to stay in their home, to have home care come in. So what I like about this is it's not like Debbie invented something that wasn't needed. It was desperately needed based on the time that we're in. And I feel better about it. Just what you said, Dana. I feel like I could trust you as a pharmacy owner much better than just someone who is, an entrepreneur and getting into the business, or, doesn't have really any connection to something that you already hold in esteem. You already hold a high value of service in your community as a pharmacy owner, and now as a home care provider of services. This makes sense. So I love this.
On that topic, that's kind of how our Happier at Home franchise came about. Pharmacists are a very, very trusted profession. Over the last 20 years, working the bench in half a dozen different pharmacies, some of which I owned, some of which I didn't, we were constantly asked, Toby, I need somebody for my aunt. She's recovering from this or that, and I need somebody for a couple of months. Who do you recommend? Which of the caregiving places do you recommend? And 15, 20 years ago, I would say, these guys drop off flyers, pick one. I don't really have a relationship with them. And I suppose it has something to do with me getting older, but over the last maybe 5, 7 years, it has really picked up pace. Toby, I need this for my aunt. Toby, I need somebody for my mom. Who do you have? And it just kind of, like Dana said, it just kind of clicked one day. Not only is there this need where we found ourselves needing it for our own family, and we still didn't have that relationship that we trusted to put our name on to recommend. And it just kind of fit. We could do this, and we are doing it. Like you mentioned, we are so trusted that when our friends are coming to us and recommending our services to somebody else, they might have already interviewed other agencies, but as soon as they realize that their community pharmacy also provides caregiving services, and it's somebody that they can see in the neighborhood, hey, it's already sold.
Yep.
That's how pharmacy works. And caregiving is just another facet that works in the community.
I love it. I love it. Also, talk to me about the expansion of your brand as a Happier at Home franchise. I know that Debbie and I talk a bunch about strategy in helping these franchise owners grow, and she's a master marketer. So talk to us about the marketing support too.
So we spend a lot, or put a lot of our money into Google advertising. They have a really great company they work with from an advertising standpoint. When we got in, we just sort of leaned into that, but truth be told, we really don't do that much advertising besides the Google advertising, which we put a fair amount of money into, which picks us up caregivers looking to apply for jobs, as well as people Googling home care services near me. We also work with some referral agencies that Happier at Home recommends. People are just hearing about us through the community. We did one presentation for the local medical group, and they send us referrals. We have a banner in the pharmacy, but we haven't really even done that much detailing to doctors because we're doing just fine with the, this is for us, we're taking this on as a part-time job on the side, trying to just manage until we figure out if we need to hire someone on. We're doing fine. We're one of the top 10 producers in the country for Happier at Homes, and we're just kind of doing it as a side gig, but it's we're working it, but it's providing good passive income for us, out of the pharmacy. I think if we decided to lean into it a little bit more and actually start, not that we're not working hard to advertise, but it comes. It's such a good fit in the pharmacy. And when you're well positioned and you have lived in this community, we live in the community we work in, we're well connected in the community. People need these services. The business is there. I'll tell you a story that right when we were opening, there was a guy that came in, was it from another company, Toby, right? Who was dropping off flyers.
Oh, yes.
Or a lady was dropping off flyers from another agency. And Toby was like, you know what, we're opening our own agency. You know, we can't take the flyers. She said, Jim, you know, there's enough business for all of us. That's fine. No problem. And that's really what's happening. Like there is enough business for all of these agencies. You know, I wondered if we were saturated. I think there's probably 5, 6 in our city. There's a lot of them.
And we continue to bump into these other agencies at events throughout the city. Most recently, we were at one of the school districts had their back to school day for teachers, and another agency was there. And we're chit-chatting about the fact that we've communicated back and forth like, hey, I've got a 24/7 client that I can't work every day. Do you guys want to split it? Right. So there is that competition with air quotes, but there's plenty of business out there for all of us. Our key is being able to deliver on what we promise. I think that's how word of mouth works. If you want it to stay positive, you got to be able to deliver, and that's what we're doing.
That's a great attitude. That's a community attitude. That's an attitude of pharmacy owners, that they take it personally. They take their community personally. And I love that. So that's a big differentiator than, like I said, just doing it for a business. You're doing it as an extension of the reputation that you already have in the marketplace. So this is I love it. I love this whole story. I do want to ask a question that I just thought of. So I'm thinking of special needs children. I'm thinking of, I just recovered or just had a baby and I need some help around, the house. Do you have an extension outside the probably the demographic that is most cared for is, of course, our aging population in geriatric care. But what other instances are you running into? Are you hearing about that Happier at Home would fit in your community?
So I think we have done a lot of post-surgery and pre-surgery. So we've had some clients, one particular client that had knee replacements, and she had no one to care for her. They wouldn't do the knee replacement surgery without care. So we took her to the hospital. We brought her home. We monitored her for, I think, like 48 hours. And she more recently had cataract surgery, needed a driver to take her to and from her surgeries. We are well poised to take care of anybody that needs assistance. We do end up finding ourselves more in that senior demographic. I have not had any, questions more on the special needs side, but we would be well poised to take care of anyone in that aspect as well.
And the funny thing is your community might not even know about it. So what you've done is you've invested in a franchise that's just starting. I mean, you guys are at the very, very beginning. Now, all of a sudden you start announcing, hey, we have special needs care. Hey, did you just have a baby and there's no one around to help you take care of, your whole situation? Or, hey, there's like something very quirky that is like, wow, I need care. And now you're this trusted provider of healthcare already. So it's just a tap in. Like I said, this is a great model, and I'm excited for the both of you. What do you say to a pharmacy owner right now that's listening to this podcast that might be on the edge and is going through the same things that you've gone through, where you're investigating other home care providers? What do you say to them?
I think if you're, you have to want it, right? It's definitely not easy work. We work all the time, but as a pharmacy owner or business owner, we always worked all the time. So if you're not afraid of work, right, and you want to make some money, it's definitely the way to go. We kind of figured, what are we going to do, right? We need to add something else in. You can add in extra services into the pharmacy, but this is much more than that. It is another business. It is, they do recommend you hire a manager. It does require an investment, and it's a franchise. So you do have to purchase the franchise. But if you want the long-term, the longevity of the pharmacy and another business, if you're really in it for the long term, this is the way to go. It also provides us that flexibility of having this other business that is tied to the pharmacy. But if we decided to get out of the pharmacy, it would still exist, and it exists with zero overhead. We run it out of an office, but it doesn't even really require that. So I think for those pharmacy owners that are creative and are looking for alternative options, this is definitely something to consider.
It's definitely doable. That's the takeaway. If somebody is on the edge, it is 100% doable. There is, like Dana said, there's work involved, but the answers are there. It is a turnkey franchise model, and the support is ongoing. We have a great network of Happier at Home franchises that we talk to. We have access to on a portal that we can ask questions to on a daily basis, on an hourly basis. We all kind of pitch in and help each other. It's very, very similar to community pharmacy because it's such a small world. And Happier at Home is kind of working off that same model. So the support is there. It's totally doable.
I love it.
And I think one more thing, Todd, that in the independent world, we've always been, creating things for ourselves, right? We don't really have that franchise model. And so not knowing what that feels like, or it's kind of liberating to say, okay, I don't have to create my own policy for this, or, what's coming up. I want to make sure I don't, I'm not doing something wrong. Like everything is provided to you. There's always somebody there kind of walking you through to make sure you're doing it right, and if you need, I needed a banner for a local school that we were sponsoring. In the pharmacy world, I just created on my, on Google Docs, and send them something. But I have access to this agency who provided me, this professional banner, in a couple days. And so the image is there, right? The brand integrity stays there. But for us, we have this really great support. And that's something we haven't really experienced before, always kind of working for ourselves. So we're working for ourselves, but we have this safety net that it feels like, and the support of all the other pharmacy owners that are doing it too and going through it too. So that's been really great for both of us.
This has been terrific. I want to thank you both, Toby and Dana Porter, champions for home care, champions for community pharmacy. The fusion of home care with community pharmacy, it absolutely makes sense. And it's exciting that you've invested in Happier at Home. We're going to track this. Would love to have you both back in a year or two just to see how things are progressing. And you're going to come up with creative ideas, both of you, I know, of how to leverage your home care agency in your community to do more for the community that is in desperate need of these services. Like I said, it's not like you're doing something that nobody needs. So
right.
Thank you both for so much for being on Happier Home PRN.